While we believe in our mission of providing people with firearms for their self-protection and providing the education and training to use these tools effectively for that purpose, we recognize that safety is paramount. That is where the Armory Project comes in. It allows people who may be going through something mentally to temporarily create a little distance between them and their firearms while they recover, without actually getting rid of them permanently.
Hey guys, I'm Yala True, and I'm one of the people who helped develop the Armory Project, and we're really grateful to have you here today for this training. I'm passionate about the Armory Project because I know it works. I've seen where people have used this to store their firearms, get the help they need, and then get their firearms back when they're ready. So we know this works, and I'm gonna hear from Renell.
Good morning, everybody. My name is Rondell Day. I'm a 10-year Navy vet, and I also work for the VA now as a community engagement partnership coordinator. My job entails essentially bridging the gap between the community and the VA when it comes to suicide prevention. I'm also a team member of the TAP program, which is a program that is near and dear to my heart, considering the fact I've lost about 3 people personally connected to me due to suicide. And when I transitioned out of the military, I also entered a crisis. So this is a program into my own. Thank you all for being here.
So we're just gonna go around, and if you wanna share anything, your first name or anything about why you're here, or why you think this topic is important, that'd be great.
My name is Jason. I'm a Second Amendment advocate, and I just think that mental health is equally important. And I don't want to ever be in a position to disregard someone's mental health just because I believe in the Second Amendment. I think they're not mutually exclusive.
Thanks.
My name is Christian. I did about 4 years in the Marine Corps as an 0352. The Armory Project is definitely something near and dear to my heart because it's 2 things that I care very much about: firearms, and mental health aspect of that. I have lost quite a few friends and some family members to suicide, so this is definitely something I'm honored to be a part of with all of you.
Thanks.
My name is Jordan. Prior Marine Corps, 08-11 in there. Lost a good bit of friends to mental health issues. Armory Project just seems like a really good way to go since we're all here wanting to be able to do more with firearms, and it just kind of goes hand in hand with that good mental health and good readiness to defend yourself and others.
Thanks, Jordan. Yeah.
My name is Christian. I spent the bulk of my 20s in the Army. The Army Project is very important to me because in addition to having my own crisis several years ago, I've also lost several friends who are veterans to suicide. And I believe this gives people another option to still be able to enjoy their rights as they should, but still be able to put mental health at the forefront.
Thank you.
My name is Jennifer. I'm an 8-year Army veteran, and I've lost several of my friends to firearms-related suicide. The Armory Project is kind of the first attempt that I've ever seen to balance, being able to preserve the Second Amendment while also still keeping veteran suicide at the forefront. And I appreciate that.
My name's Gerald. Was in the Army for 10 years. I lost several guys from my first deployment. And one guy in particular, I know if this program was in place for him, he probably would still be here. So it's a very good program, and I'm happy to be a part of it.
My name is Sam. Being a gun enthusiast and Second Amendment advocate, I have realized in the last few years especially that it's very easy for people to vilify the gun, the firearm, the inanimate object. But as we all know, mental health is a huge component, maybe even the most important component. And this is a great way to start addressing that issue and to keep people safe. So happy to be a part.
Thank you. Thanks for deciding to come on board.
So one of the common themes I heard as well talked was balance, right? Balance in the Second Amendment was promoting mental health and promoting veteran suicide prevention. So yes, there is balance, and that's what we're going to learn about today. Just about the Armory Project, some things that we could do if we do encounter someone in suicidal crisis, and a bunch of other good stuff. So what can you expect? Well, you can learn about the process to store your firearms out of home. In this training, we'll cover common myths versus realities. We'll also cover facts about suicide. We'll cover the SAVE steps. SAVE stands for Science of Suicide, asking the most important question, validating the experience, and I believe in health. We'll learn more about that. We'll learn why firearm storage is important for preventing suicides. We'll also help you discover different TAP services and different resources and helpful resources. At any point, if you need to step out during this training because it's too much for you all, please feel free to do so. And that's what we'll be learning about today.
Thanks, Renell. So we're going to start off with kind of having an open discussion about the elephant in the room of this, which is like what makes us or you uneasy when it comes to talking about mental health and firearm storage and suicide prevention with your customers, your friends, and others. So we'd love to hear from you kind of what makes you uneasy when you think about this, when you think about doing this with the Armory Project? What comes to mind? Questions or concerns? Yeah.
I know for me, especially, coming from more of a combat-oriented job in the military, talking about mental health, it's seen the stigma is that's a little bit of a weakness. So it's kind of hard to know who you can trust sometimes, because you obviously kind of don't want those things to get out, and it makes it just really hard to talk about.
Yeah, totally. I think you guys are, one of the things you're going to be doing with the Armory Project is role modeling for others that it's okay to talk about this, that there isn't a stigma. We got to take away the stigma. So in addition to providing this storage for people in need, you're also just going to be destigmatizing, having the conversation, and you are trusting people to come to. I think that, that's an important thing, is you are somebody that somebody can go to and talk to and know that they can trust you to have their best interests at heart. So I love that. Any other thoughts or concerns or questions when it comes to talking about these topics?
To kind of add to what Christian said, another thing is just them being comfortable in terms of speaking with you. We don't want people to feel like we're infringing on their rights. This has to be kind of spoken about as this is a helpful program. We're looking after people. I feel like that comes along with just conversations with people.
Yeah, it goes back to that balance that y'all brought up. Like you're going to be the balance, right? Like you're going to be able to have these conversations with people where you're balancing their Second Amendment rights and them prioritizing and taking care of their mental health when they need to. That's great. We hear some common concerns from people, and we just kind of wanted to address some of those and see what you think of them. So Renell's going to start with one.
So the first part, we'll talk about a myth. And the first myth is people who talk about suicide are just seeking attention. Now, what I was understanding, you all feel the right way.
In any situation where suicide is maybe an issue, even at a possible small, minute chance, you need to address it. So even though it can be used to seek attention, usually those people are usually reaching out for help. So they need that help. So we should definitely be a part of that solution.
And thank you so much. So, in fact, as you said, no matter how casually or jokingly said, suicide threats should never be ignored and may indicate serious feelings. Someone who talks about suicide provides others an opportunity to intervene before suicidal behavior occurs.
So another thing that we hear sometimes when we're talking about the Armory Project is some people will kind of say, well, the only people who can really help or should be helping somebody who's going through a mental health crisis is a mental health professional or a counselor. We hear that sometimes, and we'd love to hear what you guys think of that.
So, a lot of people that are maybe considering suicide or just in that mind frame, just to be provide a human connection with them in that moment. You know, obviously they're feeling alone, they're feeling hopeless, helpless. Just to be, you know, a support for them in that moment is helpful. It's always helpful. You know, it doesn't always have to be a mental health counselor or a therapist. It could just be, you know, man to man, you know, friend to a friend.
Anybody else? Like, have you ever had that? Yeah.
To kind of piggyback off of what Sam is saying, if you have the opportunity to actually intervene with somebody going through a mental health crisis, you're kind of acting as a first responder. It's you right now. The end goal is to get them to a mental health professional, but for right now, it's kind of on you.
Yeah, I love that. Like, anybody could be a first responder. That makes total sense to me.
So the next one would be asking someone if they're thinking about suicide. We'll put the idea in their head. What are your thoughts around that?
I don't think that asking somebody if they're considering it will necessarily put the idea in there, because in my opinion, if somebody's already displaying kind of those signs that they might be considering it, the thought is possibly likely already in their head. You know, if you're thinking that they're thinking about it, they probably already thought about it.
I'm glad that you mentioned that. It's not a bad thing to ask, right? In fact, the research shows that asking someone if they're thinking about killing themselves actually has a slight positive effect. Why? Because as we talked about here is the connection piece, especially as veterans. When we get off the service, the biggest thing that we are missing is that connection, that mission, right? So having someone connect with us and meet us where we're at, that will actually help them know that, hey, someone cares, right? Someone actually cares about it. And if, as you said, if they're not thinking about suicide, then they'll tell you no, there's no harm in asking that question. Thank you.
So I think this is the last one that we wanted to ask about. This is something we hear a lot of concern about, and that is if you tell a mental health provider that you're thinking about suicide, they'll take your firearm away. So we'd love to hear what you guys think of that, how that affects you, and what your stance is or belief about that.
So I think taking the firearm away is not necessarily a bad thing in the crisis situation, because there's always the possibility you be able to get your firearm back. I think that the myth is that if they take it away, I won't get it back. And the reality is that if you take it away and you get the help that you need and you recover and you heal that wound, then you can get your firearm back.
With me, it just comes back to, you know, it's fundamental rights in the Constitution that I should be able to possess a firearm. But it's equally responsible to have trigger discipline, or it's responsible to point the guns down range, or to lock your firearms so the children can't access them. We teach all these responsibilities, and we feel like this is just as important as your right to own it. And one step beyond that is when you should remove access. And it's your responsibility to recognize that you should remove access to this. You don't want to hurt yourself. You don't want to hurt the loved ones that are going to be more affected when you go. Yeah. And it's really part of your responsibility as a responsible gun owner. This is a big part of it.
Yeah, I love that. I mean, I think what we try to convey to people, and it's tricky because this is a real concern that people have, and it comes up a lot. What we try to convey to people is that mental health providers don't want to remove people's firearms, and they don't actually have that. There's like a process that has to be gone through that involves adjudication and a judge and a process. And the mental health provider not only doesn't want to necessarily put that process into place, but also doesn't really have the right to just suddenly take firearms away. But what they do want to do is try to help the person get the help that they need, so that the person can maybe temporarily and voluntarily store their firearms through a program like the Armory Project, and then get them back when they're ready. And that's what most of them are really trying to do.
I think that we are in a position to help people because they're receptive to our help in this regard. Is they come in here, they know that we train, we're advocates, we're gun guys, but we're not looking to take your guns away. So if you're in this story, there's a level of trust I think that goes with anyone that works here or that trained with you. We're absolutists too, but it's your time to now be responsible, and you can trust us.
Yeah. Exactly, and that's why this program is in place. It's great, thank you. So This is really helpful to kind of get through all the stuff with you guys, because these are some of the things that we hear a lot, and it's great to hear what your thoughts are on it. And again, I would just say, like, you guys are, by having these conversations with people, you're able to address these concerns that people have. Like, you're able to talk them through. Yeah, the whole point of this is for us to store your firearms for you temporarily, or help you get them out of the house temporarily, and then get them back to you when you're ready. And it's all voluntary. That's the main thing to keep saying. It's all voluntary. So we're going to talk a little bit about some things about suicide and suicide prevention, and why are we focused on firearms, because those are a lot of the questions that we get, and those are some of the questions you might hear from your customers or other people who you're telling that you're involved in the Armory Project. And feel free to stop us at any time with any questions. We're just going to talk about how common suicide is, because I think it's getting to be more known, but still kind of something that we need to make sure people understand, that it's really a major public health problem, and particularly among veterans, law enforcement, first responders, service members, we have high rates of suicide. And unfortunately, despite lots of efforts to try to address the root reasons, it continues to go up, those rates. So we have a slide for you that you can look at that kind of shows how much higher the rates of suicide are compared with homicide rates. And I think that that can be really surprising to people, because a lot of the reason that people have firearms is for home protection, self-protection, to take care of their families. But, and obviously that's a real concern, but you can see from those numbers that suicide rates continue to kind of go up, while homicide rates stay either kind of steady or go up and down a little bit. So that's just something that we want to make sure people understand. And just to kind of like reiterate, I mean, unfortunately, suicide rates are really highest or going higher among veterans and service members, first responders, and law enforcement. So while the Armory Project is for anybody, you all are open to helping anybody in need. This program was developed kind of by veterans for veterans because of that concern, and everybody wanting to do something to address that problem that we have as a society. So we wanted to spend some time talking to you about kind of that first responder idea that you came up with, is like, how can all of us be a first responder when somebody's having suicidal thoughts? So Renell's going to talk about one approach to how to talk to somebody.
So one question I would like to start off asking is, do you believe that suicide is preventable?
Yes.
Absolutely. Awesome. I appreciate y'all sharing. So suicide is preventable, right? It doesn't necessarily mean we're going to save everyone. We're going to be able to prevent everyone's suicide. But it's our attitudes that affect our behavior. Sometimes, if we don't believe that suicide is preventable, you might not know what to do in that situation. So the purpose of what we're going to be talking about next is to help you know what to do if you do encounter someone who's in a suicidal crisis. And that process is called SAVE. As we talked about, SAVE stands for Silent Suicide, asking the most important question, validating the veteran's experience, and expediting and encouraging them to seek help. So, SAVE will help you act with care and compassion if you do encounter someone who lives in a suicidal crisis. Starting off with the S. S stands for signs of suicidal thinking. In order to be able to recognize it, we have to understand what we're looking for. So some of the first signs are hopelessness, feeling like there's no way out, right? Anxiety, agitation, sleeplessness, and or mood swings. Feeling like there's no reason to live, so if someone is expressing to you that there's no reason to live. Rage and or anger. Engaging in risky activities without thinking. Increasing alcohol and drug use. Withdrawing from family and friends. These are some crucial signs that someone may be in a crisis. Any questions still around us?
Does that resonate with you guys?
So, just because someone is experiencing those signs or symptoms doesn't necessarily mean that they are suicidal, right? It's just warning signs to be mindful of, because it can lead to a suicidal crisis. First, now we're going to the next slide. The presence of any of the following signs require immediate attention. So if someone's thinking about hurting or killing themselves, look for ways to die. Talking about death, dying, or suicide. self-destructive risk-taking behaviors such as effective sex, engaging in risky activities, alcohol, drinking, increased use of those things. These can all, it does require immediate attention. So, any questions? Any thoughts? Great. We have risk and protective factors when it comes to suicide. So we'll talk about some of these risk factors and some for you to be mindful of. Prior suicide attempt, mental health issues, substance abuse issues, access to lethal means, recent loss, legal or financial challenges, relationship issues, unemployment, and homelessness. But some of the protective factors that go along with these risk factors are access to mental health care, a sense of connectedness, which we talked about is big, problem-solving skills, sense of spirituality, a mission and/or purpose, physical health, employment, and social and emotional well-being. So the purpose of this slide are the risk and the protective factors is to help us understand what are the risks, but also how can we protect someone who lives at risk, right? So we could bet there's a lot about having that balance. Any questions still around me?
The only thing I was going to add to that is that later on in this, we're giving you a list of resources and we'll be leaving it with the store so that you can look at it later. Because one of the things that can happen is that you can help somebody get connected to support that they need. So a lot of those risk factors, like if somebody's a veteran and can go to the VA, or if they don't want to go to the VA, if they're willing to go to a vet center or private care or whatever, there are a lot of programs to address, like if someone's dealing with a legal issue, which can be really hard on somebody. If somebody's looking at like a DUI or some other kind of legal issue, that can be a real factor that kind of puts somebody in that mindset. And there are a lot of programs out there, but it can be hard for people to connect to them, especially if they think the VA hasn't helped them in the past, or the VA is not for them, or whatever. It could also, you could help them kind of make that decision to connect to that help. And we're going to make sure you have a list of those resources.
Thank you for adding that.
So we're still talking about the signs of suicide and crisis, right? And we want to, how will you know? It's important to know that sometimes you may not know. And before we dive into some signs of things that you can look for if someone were to come into your shop and so you can recognize these signs, I would just like to understand if anybody ever experienced someone in a suicidal crisis.
I think I have. I know I have experienced it before. This was an extreme case, but the guy just was at a. I was a policeman. He was at a function, and he was just, I'm ready to go. Yeah, I don't want to be here. And we talked him down and was able to get him the help that he needed. But I think he was obviously reaching out for help outwardly. Some people reach out for help inwardly, and they give you signs, and you just have to be able to recognize them. So it's important that you go over that. Sure.
Thank you for sharing that, and I'm glad that you were able to get the person help.
Yes, sir.
The connection piece is important. So if someone were to come into your shop, right, here's some things that you all can be mindful of. Mentioning of a recent crisis, such as divorce, loss of job, military transition, and not just because they're going through a military transition doesn't mean that they're suicidal, but it is key to note that the first year of transition out of the military is one of the roughest times for people, and most suicides happen in that first year of transition. So that is important to know. In addition to avoiding eye contact, right? The person seeming tearful, upset, or agitated, maybe fidgeting a lot. A lack of interest in the type of firearm, or more just focused on one firearm. It doesn't matter what type of firearm, I just want a firearm. No firearm knowledge or no interest in any safety courses. Suggestive comments about suicide, such as, I won't have that gun for long anyway. I don't need a lot of ammunition. Behavior that seems like preparing or tying up loose ends. One to sell firearms and not care about price or logistics. Anybody have any comments or concerns, questions about these slides?
Yeah, some of these things do show up, like kind of in a vacuum, one or the other we may be presented with one or the other. Of course. It isn't always indicative. I feel like, when you start to see multiple, that's when it really kind of, starts set the alarm off in your
course.
head that something just doesn't feel right.
Of course. Yeah, and thank you for sharing that, Sam, because somebody could come in there with no firearm experience at all and just be uneducated, like, hey, anything I'll do, I just want a firearm and not be in a crisis, right? So that key part, a compound, multiple things happening, yes, that will set off all alarms. So, right. Thank you for sharing.
I have something to add to that. I think it's pretty important to the facilities that are participating in the Armory Project to kind of have SOPs in place to, I guess you can say, prevent any type of crisis that would happen within the building itself. So in terms of education, it's super important to give people education. If you have a range associated with your shop, make sure that you're not sending one out there that's not experienced. Another thing, an example would be if someone were to rent a gun, make sure that they're not alone, that they're with someone else, whether it be an employee or if they bring someone with them. I just think it's really important for the shops to kind of spearhead that and focus on ways that you can kind of work around it without being overly obvious to the point where you make people uncomfortable.
I love that, and I think like some of the shops that have joined the Armory Project and programs like it see this as part of an SOP of like, how are we going to operate to have maximum care for ourselves and our customers, right? Like you're absolutely right.
But it was one of the first discussions we had, was how to handle someone finding a gun by himself. Is it well, no, I mean, what you don't own a gun, you don't know how to shoot a gun, what do you, it's suspicious. It's just one of the many things to look out for. It's any facility that rents firearms has to take that serious. That's one of the first things we talked about.
Yeah. Great, thank you. So this is like part of a comprehensive program of how you're going to conduct your, everything in the store. Like this gets in. That's awesome.
And so, and that, you started asking questions, right? You had that question in mindset, which leads into the next portion of asking questions. Asking questions in situations like this is important. Open-ended questions that get the person talking, right? That evoke more information so you can actually understand the situation. So I would just like to understand your thoughts around asking someone if they need somewhere to store their firearm temporarily. How do you all feel about that? Is that something you're open to? Are there ways that you would ask that question?
Well, I feel like there needs to be some sort of an icebreaker. Just in general, if someone were approaching us to utilize the service, it's basically, yes, we do offer this, but we offer it in certain circumstances. That obviously there are things, or instances where they wouldn't really, I don't want to say qualify, but what they're asking us to do isn't exactly in the spirit of Armory Project.
Of course.
So the short answer is yes, we do offer that, but tell me a little bit about what services you're looking for,
Yeah.
and just in general, why.
Awesome. Yeah, thank you. And if you do feel that someone is in a crisis, right, and they're not openly saying it, because as we know, some people may not openly address or say that they're in a crisis, so we have to look up on those signs. We have to pick up on those signs, right? And you're not sure if they are suicidal. One thing that you can ask is, do you feel like you need to put some space between you and your firearm? Do you feel like you need somewhere to store your firearms temporarily? These are some ways that you can ask the question. Any thoughts?
I definitely think asking questions is super important. In my opinion, from my experience, I can speak personally about it. Whenever I did realize that I needed to seek help, I didn't seek out professional help from therapists. The first person I talked to was one of my best friends because I'm comfortable with speaking to them about that. And then that helped me take the steps to go through that process and get the help that I needed. So I think it's super important to ask questions, but how you word them is also very important. But in my opinion, as long as the person is comfortable, they will divulge information that you can find out if they need help or if they're just going through a rough time and need someone to talk to. Then
Thank you. And that caring, like asking a question in a way that shows you care and you want to know the real answer, is helpful. And I think
100%. And so there is a really important question that is not necessarily the easiest to ask, but it's an important question to ask, right? And that question is, are you thinking about killing yourself? I like to say, are you thinking about suicide, right? Because that's what it is. It's suicide. And what is that? Language matters. Language helps us meet the person where they're at, and language can help us connect with that person. A lot of what we've been talking about today is the connection piece, the care piece. People want to know that you care. People, especially veterans, they want that connection as we talked about. So by you connecting with them with that language, that will create that trusted environment that we're looking for them to have, right? So that we can give them resources, they can feel comfortable on telling us information. So there is no easy way to ask the question, right? If you do identify any of those signs, those warning symptoms, ask that question. Are you thinking about suiciding? Are you thinking about killing yourself? Try to refrain from asking, are you thinking about harming yourself? Because somebody may say, actually, I'm trying to get rid of the harm. Or are you thinking about hurting yourself? I'm trying to get rid of the hurt. I don't want to hurt anymore. So that's why I'm thinking about suicide, right? So the way you ask the question is important. You understand that's not an easy way to, it's not an easy question to ask. It may not be comfortable, but it's an important question. And as we talked about in the midst, because you ask that question, you're not going to put that bug in their head. You're going to meet them where they're at. You're going to connect with them. Any questions around that? So because we understand that it's not a comfortable or a normal question to ask, we do have some do's and don'ts, right? And we understand that none of us are going to get this perfectly. It's just some tips to have when you are in a situation, if you ever encounter yourself in this situation. So do ask the questions if you identify any of the warning signs or symptoms that we talked about. Don't ask the question as though you're looking for an answer. You aren't thinking about killing yourself, are you? Why? Because now that person's probably not going to open up to you out of fear of being judged, right? You aren't thinking about killing yourself. That's not the correct way to ask that question. Are you thinking about killing yourself? Are you thinking about suicide? Does that make sense? Yeah. Do ask the question in a natural way that flows from conversations. Try not to ask the question that's when the person is walking out of the door. You understand that it may not always happen like this, but the goal is as soon as you recognize, ask that question in that conversation. Any questions? Perfect. Next, we're going to go to the V. The V stands for validating the person's experiences, right? That validation piece talks about the validation is what helps us meet that person where they're at, helps us connect. That's what we've been talking about this whole time. So you want to talk openly about suicide. Be willing to listen and allow the person to express his or her feelings. Recognize that the situation is serious and don't pass judgment. It's not our situation to judge. It's not our place to judge, right? Judging or actually probably turn the person away. And although the situation or why they're experiencing a crisis may not be serious to us, it's serious to them. And it's important to validate that. So in addition to the installation of hope, right? Always letting them know that hope and help is available. Hope is what changes things. Letting someone know that there's light at the end of the tunnel. We're here to support you along the way. Can really make a big difference, right? And we understand that validation doesn't come easy. So some things that I like to do is just listen to them, what they're saying, right? I can see that you're going through a tough time. I can see that you're trying your best, right? Identify whatever it is they're saying and just let them know that you see them. We just want to be seen. I think the most powerful thing in the world that you can do to someone is actually hear them and see them, and that's what creates that connection. Any questions on validating? Or any examples of how you can validate somebody?
I feel like it goes with what several people have said already. Veterans, especially looking for that connection. As veterans, I feel like we should be looking to help validate those feelings because nobody can sympathize or empathize with a veteran like another veteran. Mm-hmm. And veterans are generally more open to other veterans, a lot of times more so than their own friends or family. Mm-hmm. So I believe that having that conversation and using that shared status to help them open up is a very important step within, say.
Love that. I think it bears repeating as many times as possible that one of the most important things you guys are doing is destigmatizing this. Having these conversations, normalizing it.
The next portion of SAVE, which is the last portion of SAVE, is E. Encouraging treatment and expediting get help. So what should you do if you think someone is suicidal? Well, first, you don't want to keep that behavior a secret, right? Don't leave him or her alone. Try to get the person to seek immediate help from his or her nearest hospital or primary care provider. Essentially, in this case, we have the 988 resource, right? The 988 is the National Suicide Crisis Line, right? If the person isn't a veteran, they could call the National Suicide Crisis Line. So we try to go, if someone is in a suicidal crisis, 988 over 911. If the person is a veteran, you have the 988 press 1, right? The pressing 1 option gets them connected directly to the Veterans Crisis Line. And when they are connected to the Veterans Crisis Line, they'll be able to get on spot crisis mediation, in addition to connected to the suicide prevention team at their local VA, in which they'll follow up in a matter of 24 hours. If it's a week, it'll be the next working day. And that's important for veterans. So and then it helps expedite getting the services that they need. Again, if you do find yourself in that situation, the installation of hope is important. So reassure the veteran or that person that help is available.
Do you guys have any experience with the 988 line or views on it or anything like that? Because we find people aren't as familiar with it as you would hope, so.
I have a little bit of experience with the 988 press 1 option, and it just so happened to be on National Suicide Prevention Day. I think I was on, it was a low point in my life, and I think I was scrolling through Instagram just kind of mindlessly, and I just so happened to see the ad for it,
Yeah.
I'm like, it's probably something you should probably call this number.
Yeah.
So I called it, somebody followed up with me, and I think it was the next day, and maybe the day after, I was sitting across from a counselor at the VA, so definitely helped me out and saw me on the other side of crisis, a more healed person.
Thanks for sharing that. I mean, I think it's so important to use that resource and to know that on the other side of that, there are people who have been trained. A lot of the people who answer the phones in the Veteran Crisis Line are veterans themselves who've gone through a lot of training and are dedicated to helping other veterans. And the regular 988 line for civilians is a big help too. And on the other side of that is often a lot of resources in the community. And I think that in this day and age, we see a phone number and we think that it's just going to go to like a dead end or a series of like punching numbers and never getting any help. But I can say that I've heard stories like yours that actually it can lead to help. So I just want to encourage people to think of that as a resource that we can tell people about in our community. Thanks for sharing that. So we wanted to be sure that we talk about why we're focused on secure firearm storage to prevent suicide. And this is actually something a lot of groups, national groups, are starting to get the word out. Like secure firearm storage is part of being a responsible firearm owner, but it's also a huge part of suicide prevention. And so in addition to you all raising awareness, talking to your social networks, your friends, your customers, your buddies, and providing this out-of-home storage to people in need, I think you also can just get the message out that secure firearm storage across the board is important. And I'm sure you talk about that with your customers anyway, but we want to talk a little bit about why. So there's some things we're going to go through about how suicidal crises can often be very brief, even though maybe someone might have suicidal thoughts over a period of time. That actual crisis where they decide to take an action can be quite brief. And then the deadliness of the attempt is sort of determines the outcome. So what somebody uses when they're thinking about suicide actually makes a huge difference. And unfortunately, firearms are the most lethal means of a suicide. And then 90% of people who attempt a suicide and survive it do not go on to die by suicide. And so you can see if firearms are the most deadly, they're the most likely to succeed and not get the chance to get the help they need. So we've got a slide here that I think really kind of brings it all home, which is about how firearms are the most lethal means. And it just shows you in a really simple graphic that even though fewer suicide attempts involved a firearm, so that's kind of that blue, the suicides that involved a firearm are 80 to 90% likely to be fatal. So that's that red part of that slide. And so it's really showing you, like, if somebody gets a hold of another method other than a firearm, they're not as likely to be successful in dying by suicide. And so what are we trying to do? We're trying to make it so people can't get a hold of a firearm, a loaded firearm, when they're going through a suicidal crisis. A lot of people say, well, what about them just substituting with another means like medication overdose or something like that? But a lot of research shows that people don't actually, if they decide that they're going to make an attempt and they're going for a firearm and they can't get to it for some reason, they're not going to just go to another method. They're actually going to kind of pause. That's why we're trying to put that time and distance between a person and a loaded firearm, if that's their preferred method. Unfortunately, with veterans, with service members, with first responders, with law enforcement, they're very familiar and comfortable with firearms. They have access to firearms. And so that's why we're losing so many veterans and service members and first responders and law enforcement to firearm suicide, because they have access to firearms in the home, they're comfortable with them, and if they're thinking about it, that's going to be their preferred method. And so that's why we're really focused on how do we put that time and distance between a person who's going through that crisis and their loaded firearm. You can see we also just have kind of what the numbers look like in our country right now. We have about 71% of veteran suicides involved with firearms. So that's why we really try to make sure people understand why are we focused on firearms. It's not because we're trying to limit anyone's access to firearms. It's because if we can put time and distance between a person and a loaded firearm when they're going through a suicidal crisis, we're going to have the biggest impact on veteran suicide. But even you can see with civilians, it's still about 62% of civilian suicides involved with firearms. And one really kind of alarming thing is when you look at certain populations. For example, among women, the use of a firearm to complete a suicide or to die by suicide is really gone up and has actually surpassed other methods. So we want to be thinking about women and firearms as well. I think a lot of times the stereotype is like this is going to be a problem with a man, but it's not. We really need to be worried about women and firearm suicide as well. So just to kind of round that up and then see if you have any questions about it, we've got some of the research for you showing that people who were thinking about suicide but then made the decision to actually die by suicide really were only thinking about it for a very brief period of time. For a lot of people, it was less than 5 minutes. For some people, it was like 20 minutes. For most people, it was an hour. So you can see if you can make it harder for them to get to a firearm, even 5 minutes, if they're storing their firearm in a gun case that's locked, or the firearm's unloaded, or they've taken the firing pin out, maybe because they have kids in the house, or they know that they're going through a mental health crisis. They've taken the firing pin out or in some other way made it harder to use it. That's enough time to make a difference. If they've stored their firearms temporarily outside the home with a family member or a friend or with you all, then that's a real distance for them to go get to it. And that's enough time for them to really have a second thought, think about the people in their lives who they have a reason to live for, or think about the fact that they do want to tell somebody, they do want to go get help. That's the time that they need. And so that's what we're all trying to do here together, is like spread that message, give people all those options, talk about it with them, and give them the ultimate option, which is if somebody's in a real suicidal crisis or been going through something. We hear about veterans who maybe have an anniversary coming around that's hard to think about. Those are the times where they might want to be storing their firearms outside the home. Another example would be if somebody's goes to inpatient care because they've been having a really hard time, and they go to inpatient care and they know they're being discharged from inpatient care, they may not want to come home to having firearms in the house. And so they may reach out and say, hey, can I get some help storing my firearms with you guys temporarily till I kind of get through this transition. So those are some of the times when this might come up. I think I've covered kind of like what we wanted to convey to you about all that and the research on it, but I'd love to hear if you have any questions about it or if any of that's unclear.
I just have a comment, and I can't help but think of the like the angry email, the angry text message effect, where something
Yes.
triggers you
Yeah.
and you type out that angry email, you type out that angry text message. And if you just give yourself 5 minutes just to chill
Yeah.
and read it back a couple of times, you usually end up erasing it.
You're right,
Or
totally.
at least thinking better of it and writing it in a little different way.
That's a great analogy.
I have a comment. Most of us are all teachers here as well. I teach a concealed carry class, and I can tell you that this is not in there. And it's not in there from the instructor portion of it. They don't really cover this. And I think that I have to definitely add this into the class for sure. So thank you guys for putting this on so I can, it just hit me when we were talking about it. Like, I need to put this in my course for sure.
You're like our best friend right now because we actually have a video that we made that you can include in your class. We've got slides, we've got a video. We can get all that stuff to you after this, but we really appreciate that. That's so right on. Thank you. Any other questions or comments about any of that stuff they just went through? Okay. So just, to kind of like wrap that stuff up, I mean, what we're trying to say is that having access to a firearm during a mental health crisis really increases the odds that somebody is going to die by suicide. And we are all here together trying to stop that. We want to be the time and distance in between that person and a loaded firearm. We can really protect one another by being alert to the signs among our friends and family, and in your case, maybe customers, and being able to be there for them. If someone's at risk, we want to be able to figure out how to keep their guns for them, or store their guns for them, or even you can just be suggesting to somebody that storing firearms with a friend or family member, success does not mean that they're storing their firearms with you guys necessarily. Success means they're storing their firearms with somebody or somehow putting time and distance. So if they live in a state where they're allowed to give their firearms to somebody else to hold on to for them, they can also do that. So there are other reasons why we want to talk to people about secure firearm storage, and we don't want to neglect that, right? So some of the other reasons would be there are children in the home who maybe aren't familiar with firearms, shouldn't have access. Children are visiting from out of town. Maybe there's an adolescent in the home who's going through a mental health crisis, or unfortunately even children younger than adolescent really shouldn't have access to firearms when they're going through a mental health crisis. There might be older adults in the home who are impacted by like dementia or cognitive issues or traumatic brain injury. There are lots of different reasons. And then there might be reasons like somebody's deployed for a long time and they don't have anywhere else to store their firearms. As a store, you're gonna make a case-by-case decision about whether to store firearms for somebody in those circumstances, but those are all good reasons to talk to people about secure firearm storage and maybe storing them at the house temporarily. So the final slide for kind of this series is about all the different ways that people can be storing firearms more securely, either inside the home or temporarily outside the home. And all of this is voluntary. It's part of responsible firearm ownership. You guys know that better than I do. But these are all things that you can be talking about to your customers or in your social networks of people that you're connected to. So this next part, we're going to actually talk about the Armory Project. What are you all going to be doing, especially if you're taking in and storing somebody's firearms for them temporarily? So I wanted to start a little bit by asking if you could say something about why you guys decided to have the store join the Armory Project.
Sure. In the whole debate on gun violence and deaths that occur with firearms, obviously suicide is a big portion of that, and veteran suicide specifically. As responsible gun owners ourselves, as a shop who we really want to impart the education and the knowledge necessary to use firearms effectively and appropriately. I feel like addressing the mental health issue part of this is it's something we want to do, but I feel like it's also our obligation.
Thank you. And yeah, we really appreciate that. And I mean, this wouldn't happen without you guys and shops like yours. There would be no Armory Project. So we're happy to have you as partners. So we wanted to talk a little bit about how firearm owners in your community might hear about the Armory Project. And there's a lot of different ways. We're doing our best to get the word out about it. You guys are going to have marketing materials up in your store. So you're going to have brochures near the cash register, posters on the walls, and somebody might just ask you about it. They might say, hey, what is this? Or if you're talking with customers, you might say, hey, we're doing something new. We joined the Armory Project. I wanted to tell you a little bit about it. So that's one way they might hear about it. Another way is that we have a website for the Armory Project, and there's a map up there, and your store is on that map, and it's a pin that someone can click on and see your information, get your phone number, get your contact info, and they might reach out to you that way. We're starting to get the word out to healthcare providers and others in our community. We're going to veteran service organizations and talking about this. We're going to community organizations and talking about this. Renell's doing a lot of this work, and we're telling healthcare providers, especially in the VA, about the Armory Project. So somebody might find out about it through that. Another way is that you guys, the shops who are coming on board with this, firearm owners who are social media influencers are posting this on social media, talking about it on YouTube. People are doing radio spots about the Armory Project, so somebody might hear about it that way. And then there's just word of mouth, just hearing about it from, if you start telling people you're involved in the Armory Project, somebody's going to hear about it through word of mouth. So those are all the different ways that somebody might hear about it. How is somebody going to come in and ask for it? We don't know. We don't know. You're going to be telling us how it's happening. But again, it could be somebody that you told them about it one day, and 3 months later they came back and said they needed it. It could be somebody that you're close to. It could be someone in law enforcement. We know some law enforcement agencies that Renell talks to and tells about the Armory Project are starting to say if they get aware of a problem with someone in their community, they don't necessarily want to be the ones to take possession of that person's firearm. So they may even come to your store and say, hey, we've got a situation. Would you be able to store this person's firearms for them? But also somebody may just call in. And sometimes when people call, they might just ask a question of like, hey, do you store firearms? And maybe that's one of the tougher ones because they're not saying what's going on and they're not saying why they need to do it. They're just calling and asking a general question. So we wanted to talk a little bit about how to handle that if somebody just calls the store and says, does your shop store firearms? So we wanted to hear a little bit from you about how you want people to handle that if they get a phone call like that. And then we'll talk a little bit about some suggestions.
Sure. Yeah. Like I kind of said before, the answer to that question is yes, we do store firearms in certain circumstances. What type of assistance do you need with storing your firearm? And tell me just a little bit about why. We don't have to push to get every nitty-gritty detail because I feel like if you start pushing a little too much, it might back them off a little bit. Basically just providing them with the information that, this would be a temporary thing. This is not, anything permanent by any means. And that, we're here for you. We're here to listen. We're here to help you however you need us to. Yeah.
Great, thank you. Do you guys feel like if somebody called and asked, does your shop, do you guys store firearms, that you would just kind of automatically think of the Armory Project and say, we've got this program called the Armory Project, but I need to hear a little bit more about what you need. Like, would that work as a way to answer phone calls about this?
Definitely.
Good now, for sure.
Yeah, we feel like it's kind of normal for us to just be personable to people. We're kind of known for that. We have a lot of customers that come in and they're pretty shocked at how welcoming we are. That's pretty much the mission. I mean, it's in the name. It's neutral ground. So we're welcoming of everyone, no matter what you're going through, no matter what times, hard times, good times. We're here to help you if you need that. And we do have the facilities in place to be able to do that.
Thank you. That's great. And it's great to hear that now like, if you get a phone call and you know what to say. Great, thanks you guys. Any other comments or questions about kind of that part of it, of how people might hear about you, and that you're doing this, or might not talking about it? So we wanted to talk through with you, like, what are the ways that you can temporarily store someone's firearms for them if if you decide that they need it and that you're going to do it for them. So there's kind of two main ways in our understanding that you can do this. One is to utilize like a temporary storage agreement. And we have a copy of a template in your folders, and we also give that to you guys on email so you can edit it, adapt it as you see fit. But we created this in response to TAP partners who were asking, like, what kind of document could we use to kind of not just have like a written document about it, but it also helps you have the conversation with somebody so you can kind of talk through with them what can they expect of you and what do you expect of them, because this is an agreement and you can expect some things of them as well. So we have a copy of that in your folders, and I just wanted to talk through some of the things that are in there. So in this instance, if you do this temporary hold agreement, the firearms are going to go into the A&D book for the store, and that means that the person has to pass a background check to get their firearms back. And so that's part of why that written agreement is there for you to talk through with them so that they understand that and have that clear expectation that they're going to have to pass a background check to get their firearms back. We'll talk a little bit in a minute about I know there are some concerns about what happens if they don't pass the background check, and we'll talk about the options for that. And that's all written out in the template agreement as well. But I just kind of want to go through what else. So the agreement specifies the condition of return, which is just that they're going to come back in, pass a background check, and get their firearms back. It's an opportunity for the firearm owner to hear that if they want to talk through and share with you as they're going through the agreement, that they're going through something in their lives, a challenge or a mental health crisis, they're thinking about suicide. They don't have to share that with you, but if they do, it's a chance for you to be able to say, hey, we also have this list of resources, or I'm here to listen for a little bit, or, we know somebody at the VA we can connect you with who's in suicide prevention if it's a veteran. And then you can provide them with resources. So what's the downside of using that form of taking the firearms in? It's that they might not pass a background check when they come back. So our understanding is that there's a couple options in that situation. Option one would be they can appeal. And we have information in the template agreement about how they can appeal. And we have also like a frequently asked questions document that we're going to share with you guys, and that walks through how they can do the appeal. The other option is if they're denied on appeal, our understanding is that you can release those firearms to someone else who's not a prohibited possessor. But that person will probably need to give you some kind of written assurance that they're not going to make those firearms available or in the same house as the person who's been denied. I'm probably not going to go through all the details of this. It's all written out in the frequently asked questions document and the template agreement. But these are the kinds of things that people get concerned about, that firearm owners get concerned about, and that people on your side in the retailer space get concerned about. And so we do try to think through all the different steps and options. But what we try to convey to the customer who might be using this is your wish, your desire, your goal is to temporarily store their firearms for them voluntarily and then give it back to them when they're ready. And that's the goal. And so nobody's trying to keep anybody's firearms. You're just trying to help them when they're in need. What do you say to someone when they're going through the background check?
So just as a general practice, we tell people that we cannot answer the questions for them. We can help to clarify the question in their mind so that they know, what the question is actually asking, but we can't, actually answer for them.
No, thank you. So I'm just going to go over really quickly some of the things that are in that template storage agreement. We just talked about a lot of them, but I just kind of want to reiterate. You're going to decide as a store is like under what circumstances are you going to store firearms or people? Is it going to be free? Or are you going to, after a certain period of time, is there maybe going to be a small charge for storing the firearms? you might want to collect a little bit of contact information from the person so you can make sure that you can contact them. And you might want to say to them, hey, listen, I'm going to check in with you in a month or 3 months or whatever and see how you're doing. All that is up to you guys. So what we provided is just a template, and then you're going to adapt it for how you want to use it in your circumstances. We do have a place on there where the person can give a second contact, like somebody that you can contact if they're not getting back to you and you can't get in touch with them, because you're going to want to be able to be in touch with them and say, hey, we still got your firearms. Like, are you planning on coming and getting them, or do you need us to get them to somebody else or something like that? But the point of the storage agreement is both so that you feel like you're really clear on what you're offering, and the person that you're working with to help is very clear on what you're offering to them and what you're asking of them in return, which is kind of like being responsible by remaining in touch with you and letting you know what they want you to do next with their firearms. So the other option, which some firearm retailers have decided they're going to use for the Armory Project, and again, it could be on a case-by-case basis, depending on the individual firearm owner and how well you know them, is that you could use a cleaning and storage service kind of way of holding firearms. So what that means is if you provide any gunsmithing and cleaning at this site, or send things out for gunsmithing and cleaning, you can take someone's firearms in on a hold for them under gunsmithing and cleaning. And you actually have to do some work on the firearms under that, if you're going that route. So some of the pros for that are that there's no background check needed for the person to get their firearms returned to them when they're ready. And they don't have to really talk about the reason why they're storing the firearms with you. It's a little bit easier for them to just say, yeah, I just want to drop this off for you, to get some repairs done and not really share anything personal. But it still gives them some time to reach out and get some help. But the cons to that are that it doesn't provide an opportunity for you to be able to tell them about any resources, or kind of like let them know that there's help out there for them if they're going through something in mental health. You also might not know like what is what's their legal state at the time of return. It may cost something for you to do gunsmithing and cleaning, and so the fees on your end may be prohibitive, or you may have to feel like you have to charge the person a fee, and then that may be prohibited for them. So you can see there's like pros and cons. Another thing which Sam and I had talked about earlier was that the ATF is saying another option would be that you could have a locker or kind of storage that is outside, maybe in the common area of the store, where an owner could come in and put firearms in there, lock it themselves, maybe with you have a lock on there and you let them set the combination and you don't know what it is. That's the only case where the guns absolutely don't have to go into your A&D book. They don't become part of, you're actually not taking possession of them. You're just allowing them to store the firearms on site. And that might be a better option for some people, because then they don't have to worry about passing a background check to get their firearms back. They don't have to worry about talking about their mental health or anything like that. The cons to that are that a lot of stores don't have space for that. I've had stores tell me like floor space equals money, right? That's sales. So you might not have space for that. Again, it doesn't give that person the chance to talk about what they're going through, or to get access to resources, or to be encouraged to get help. But those are all different options. And I don't know if you have thought at all about which options are the most appealing to you here.
I think what's easiest and most clear cut for us is to check the guns into our A&D book and require the background check. I feel like it just it provides protections for both parties. They're receiving the service. We know that we are giving the guns back to someone who is not a prohibited person. I think that's the easiest most protective way to go for us. But it's not to say that those other methods aren't useful or could be useful in a certain situation.
Great, thanks. The main thing about the Armory Project, I would say, that's the most important to understand, is that we know that we're not a firearm retailer. We're people who are trying to help support the Armory Project, But the farm retailer and the staff, you're the ones who have to make the decisions about how you're going to do these things. And so we're not telling anybody how to do this. We're more saying, here's some of the options and here's some guidance and help in how to do it. And then you all are going to be the ones who are the deciders. So we're kind of almost at the end, just to kind of, I think Ronaldo's going to wrap up some of the points about how to talk to somebody, and then we'll see if there are any other questions.
So as we transition into some resources, I did want to recap SAVE and note that the Armory Project is voluntary, right? So some people that you're going to be getting this call, and it's going to be voluntary. Some people that come in, and, it's going to be voluntary, them turning in their firearms. And there may be no need, or they may not want to talk in detail about their situation, right? But then there are going to be some cases where, where you're unsure if the person is suicidal and you want to be able to intervene. So that was the purpose of addressing SAVE, as well as if the person does want to talk, right? You know how to talk to them. So that, I wanted to just recap the purpose of SAVE. And so when talking with a person at risk for suicide, you want to remain calm, listen more than you speak, maintain eye contact, act with confidence. Again, it's not a situation to argue, so do not argue or pass judgment. Use open body language. Limit the questions, or if you do have questions, try to ask more open-ended questions. Use supportive and encouraging comments, and be honest. Let the person know that there are no quick solutions, but help is available. That whole piece is critical, but the truthfulness is critical as well. Let them know there's no quick solutions, but we're here to support you and help is available. Just to recap again, SAVE stands for understanding and identifying the signs of suicide, knowing how and when to ask questions, validating the experience, and expediting and encouraging treatment. You have 988, which is the National Suicide Crisis line, and you have 988 Press 1, which is the Veteran Suicide Crisis line, and it gets the veteran connected to someone who could de-escalate them and expedite mental health treatment with a suicide prevention team at their local PA.
So we're going to talk in a minute about some resources that we're going to leave with you, a resource sheet, but we just wanted to see any comments or thoughts about this, anything you want to share, like before we wrap up?
I just want to say that I really am grateful to the Armory Project and this in the spirit of it and what it's trying to achieve. I would say that people who are considering harming themselves are, one of the reasons behind that is they lack options. And this is just providing an option to people to help them get out of whatever situation they're in.
Thank you.
So I think what my experiences with law enforcement and military teaching is we tend to not recognize humanity. So we all are human first. We're not African American, we're not veterans, we're not male or female, we're human first. So when you account for the humanity of the person, it's easier to see them and what they're going through because we all relate to being human.
Kind of go along with what Christian was saying. People will tell you all the resources you need to do to like buy a firearm, for instance. There's so many resources everyone knows about. Or things like suicide prevention. A lot of times there's like, really you only get like the hotline, or somebody will tell you go see a therapist, go see counseling. I like that there's more resources out there, because a lot of times it's just a phone call, just a therapy, and you don't get the, what do I do with my dangerous belongings, or something that can harm me if I decide to go that route. So I think that the more resources we have out there, the more resources we not only advocate for, but kind of advertise for as well, would probably help a lot more in the long run to kind of bring those yearly numbers down.
Yeah. Thank you. Well, I think we're just we want to make sure that you know about resources in your community. And so we have a resource sheet that we leave with you guys. And it goes through kind of reminding people about the 988 number. People can text to that number if they want to, if they don't want to talk to somebody. And they can also do a chat. There's like a chat that people are kind of getting used to doing. There's also resources for people, for civilians that are on that resource list. But we also want to think of ourselves as a new resource for you. You know, you guys know us now. We're here. Renell works in this space with the VA, the local VA, and we just want to be here. As our information is up on the last slide, how to contact us, how to reach out. But we know each other now, and so we want to be a resource to you as well. We are so grateful to you for your willingness to listen and to learn and to teach us and to be a part of this. We can tell, you know, the commitment that you have to helping people in your community. It really comes through, and we're so grateful, and we're grateful to know you and be part of the same community now.
As Callan said, I'm honored to be, you know, a part of this with you all. I could tell the enthusiasms. Y'all have a wealth of knowledge. I've learned a lot from you all, and yeah, thank you all for having us today. And thank y'all for your support in the mission to prevent suicide by fighting.
Thanks, you guys.
Thank you.
I do.